Good morning to Alaska and Corlia. I welcome and support this motion. We all remember just before Christmas, when the government voted against paying student nurses, the wave of disappointment and anger that rolled across the country in the days after. Young people, student nurses, sometimes their faces still bearing the marks of the face mask that they've worn on the 12-hour shift, looked at the TV screens as Fianna Fáil, Fine Gael and Green votes, one after another, torpedoed their chance of getting paid. Numbered among those who voted against student nurses getting paid was the Minister for Higher Education, Simon Harris, who back in March had issued a press statement saying that they would get paid. Now, it's one thing not to pay student nurses. It's one thing to make them work on the front lines without pay in extremely hazardous conditions, in daily fear of their health and the lives of their parents and their grandparents at home. But is another cruelty entirely to promise to pay them and then come into this chamber and vote against it, just as Simon Harris did before Christmas. To any student, nurse or midwife watching this debate, I want to outline exactly why they haven't been paid yet. There are 72 of us in this chamber who want to pay them, but there are 77 members of this House, Fianna Fáil, Fine Gael and Green TDs, who do not want to pay them. Learn the names of these 77 TDs and repay their arrogance and greed in the ballot box in the next election. We in Ain too have been speaking to many students on the front lines, and I must say it has been incredibly moving to witness the selflessness of their work. They won't strike simply because they do not want to result in their patients suffering or dying. And when they phone me, they spend the majority of the time on the phone call expressing concern for their patients. They tell me about the wards that they're working on, of the heartache of seeing patients take a bad turn. They tell me of ringing the bell looking for senior staff to help them, and then coming to the realization that there's very few senior staff in that particular ward to help them. And that when they get talking to a TD on their phone, the priority of their conversation is the welfare of their vulnerable. It's only at the very end of the conversations do they turn to the economic circumstance that they're in. These are ordinary men and women, mostly women, around the country doing extraordinary things for us. Minister Harris, when he was Minister for Health, wasted billions of euros in overspends in the black hole that's called the Children's Hospital. Many other government ministers wasted billions in overspend with regards to broadband, millions spent on the Dáil printer, millions spent on faulty PPE that's now deemed unusable. Compare and contrast the Fine Gael and Fianna Fáil and Green proposal to increase the salary of the Department of Health Secretary-General by €81,000. Not €81,000 as a full salary, but an increase in salary, on top of a salary of about €210,000. That means there is an income inequality in this situation of 55 times to 1. The new Secretary-General will earn 55 times the income of student nurses and student staff on the front lines of our hospitals in the most critical health crisis that this country has ever witnessed. Minister, you earn 34 times on an annual basis the income of a student nurse working on the front line. Now, many people watching this debate will feel that actually that should be reversed if fairness was in place. I think, Minister, if you realised for 1 minute, if you experienced for 1 minute what student nurses are enduring mentally, physically and psychologically on a daily basis, you would not be putting the amendments that you're putting before this House today. The amendments that you're putting before this House today has the objective of destroying the opportunity of actually paying student nurses and student midwives a proper wage. I would ask the Minister, I would ask Fianna Fáil, Fine Gael and the Greens today to cut out the cheap words, to cut out the hand-clapping, the patronising hand-clapping, and actually pay student nurses and student midwives what they're entitled to, what they're earning every day in service of the people of this country. Gurb Mahaguth,